Good evening. We begin tonight with some of the key takeaways from today's weekly COVID media briefing. Our Shira Matsuzawa has what was discussed.
I worry every single day about the potential of seeing a child's death notice because perhaps they were too young to get the vaccine or had underlying health conditions that prevented them from getting the vaccine.
Emotions running high during Tuesday's Idaho Health and Welfare weekly COVID-19 media briefing. State Public Health Administrator Elke Shaw-Tolik revealing as of Tuesday afternoon, she's looked at the names of all 2,790 people who have died in Idaho from COVID, and they're getting younger, and they're unvaccinated.
Weekly case counts among children are increasing more rapidly than our case counts among adults. In fact, infections among children have reached record levels in the past few weeks.
Deputy State Epidemiologist Dr. Catherine Turner says right now 20% of all cases are infections in children, which is much higher than what we were seeing this time last year.
The number of infections identified among children has recently skyrocketed. We surpassed our previous record set in December of 2020 a month ago, when just over 1,300 cases in children were reported during the last week of August. Last week, nearly 1,700 cases were reported among children.
This comes as cases in many schools continue to climb.
There are over 200 classrooms in Southwest Idaho right now who do not have a substitute in them.
Paula Keller, superintendent of the Nampa School District, as well as president of the Region 3 Superintendents, joined Tuesday's call to share what's going on in schools, particularly in the southwest area of Idaho. She says although half of the districts in southwest Idaho saw an increase in enrollment, many are now experiencing a decrease in attendance.
In Nampa, for example, 80% of our students weren't attending regularly during the first four or 5 weeks of school.
So where are people contracting COVID from?
For the most part, a lot of transmission is still going on in households.
Dr. Turner adds one of the challenges they're facing is during investigations, those getting infected are not cooperating, so they don't always have the necessary data to track that information.
That being said, a lot of the time, people are not sure where they could have been exposed.
Now, Dr. Turner also says although children are less likely to experience severe illness from the coronavirus, more than 200 have been hospitalized since the start of the pandemic, and you can watch today's meeting in its entirety at ktvb.com. Mark?
A lot of emotion in today's daily briefing, something we haven't seen a whole lot of up until this point.
You can definitely see the toll it's taken on a lot of them.
Yeah, for good reason. All right, Shira, thank you.